Recent clinical findings suggest that more than 65% of adults over the age of 60 live with chronic back pain, yet the majority of them are treating the symptom, not the cause. And that's a problem, because when back pain becomes a daily companion, a stiffness when getting out of bed, a sharp reminder when standing too long, or a dull ache that appears by evening, the instinct is simple. Take another pill, another anti-inflammatory, another pain reliever, another prescription meant to quiet the signal your body is sending. But here's what most people over 60 don't realize. Pain medication rarely fixes the underlying reason your back hurts. In fact, spine specialists are increasingly concerned that relying on pain relief alone may allow the true problem to worsen silently. Because the real driver of chronic back pain after 60 is usually not what people think. It's not simply getting older. It's not inevitable wear and tear. And it's often not even the spine itself. What many specialists now see instead is a chain reaction happening inside the body. One involving circulation, muscle support, nerve sensitivity, and inflammation. When these systems start to weaken or fall out of balance, the back begins to suffer. But here's where it becomes even more interesting. In many cases, the pain people feel in their back is actually the final signal in a much deeper physiological process, a process that may have started years earlier. Muscle fibers gradually losing strength, blood flow slowly becoming less efficient, small stabilizing muscles around the spine quietly shrinking from inactivity, and nerves becoming increasingly sensitive as inflammation builds in surrounding tissues. By the time pain appears, the underlying system has already been struggling for quite some time. But this is where most people go wrong. They assume pain means damage. And that assumption leads them toward the fastest solution available, medication. Yet modern research in musculoskeletal medicine shows that many forms of chronic back pain after age 60 are actually functional problems rather than structural injuries. In other words, the spine itself may still be strong, but the systems supporting it have weakened. Think of the spine like a suspension bridge. The bones are the towers, but the muscles, circulation, and connective tissues are the cables. If those cables lose strength, the structure becomes unstable, even if the towers themselves are intact. This is why so many people experience back pain without any major injuries showing up on scans. But here's where the story becomes even more serious. When the body senses instability around the spine, it triggers protective mechanisms. Muscles tighten, inflammatory chemicals increase, nerves become more sensitive. This creates stiffness, aching, and sometimes shooting pain. And over time, if nothing changes, the body adapts to this pattern. The pain becomes chronic. But the important message here is this. Chronic does not mean permanent. Many of the biological factors driving back pain after 60 are modifiable. Circulation can improve. Muscle fibers can rebuild, inflammation can calm down, nerves can become less sensitive, and the spine can regain stability. But before we talk about solutions, there's one critical misconception that needs to be addressed. Because if you ignore this, here's what happens. You may unintentionally make your back pain worse. And it has to do with something millions of people are doing every single day without realizing its impact. Let's talk about movement. What most people over 60 don't realize is that the spine depends heavily on small, stabilizing muscles that most of us never think about. These muscles are not the large, visible ones like the biceps or quadriceps. They are deeper, smaller, and incredibly important. They include muscles such as the multifidus, the transversus abdominis, and a network of stabilizers surrounding the lumbar spine. Their job is simple, but vital. They hold each vertebra in its correct position, they control small movements, and they protect the spinal discs and nerves from excessive strain. But here's the hidden problem. After the age of 50, the body begins to lose muscle tissue at an accelerated rate, a process known in medicine as sarcopenia. On average, adults lose 1 to 2% of muscle mass every year after midlife, but the stabilizing muscles of the spine tend to weaken even faster. Why? Because they are activated primarily through movement and posture. When someone sits for long periods, these muscles remain inactive. Over months and years, they shrink. Their nerve connections weaken, and the spine gradually loses its support system. But here's where it becomes more concerning. Once these muscles weaken, the body tries to compensate. Larger muscles in the lower back begin doing work they were never designed to do. This leads to muscle fatigue, tightness, and chronic inflammation. Eventually, pain appears. But here's the key point. The pain isn't necessarily caused by a damaged spine. It's caused by an unstable support system. Spine specialists have been observing this pattern for years. In fact, imaging studies often show something fascinating. Two individuals may have similar age-related changes in their spinal discs, but one experiences daily pain. The other feels none. The difference? Muscle support. This changes everything after age 60 because strengthening the right muscles can dramatically reduce the strain placed on the spine. But this is where many well-intentioned people make another mistake. They assume the answer is intense exercise, heavy workouts, aggressive stretching routines, but that approach can actually backfire. Older spinal joints and discs respond best to gentle, controlled activation, not force. So what does that look like in practice? Let's begin with one of the most powerful exercises spine therapists recommend for people over 60. The abdominal brace. It's simple. Lie on your back with your knees bent. Take a slow breath in, then gently tighten your abdominal muscles as if preparing for a light cough. Hold that contraction for 5 seconds while breathing normally. Then relax. This small movement activates the deep core stabilizers that support the spine. Repeat this 8 to 10 times. Another effective movement is the pelvic tilt. Again, lying on your back, gently flatten your lower back into the floor by tightening your abdominal muscles and tilting your pelvis slightly upward. Hold for a few seconds, then release. This exercise restores coordination between the core and spinal muscles. But here's where consistency matters more than intensity. Just 5 to 10 minutes a day of targeted activation can gradually rebuild the stabilizing system around the spine. And when that support returns, pressure on the joints and nerves decreases. Pain often follows, but muscle strength is only part of the equation. Because even strong muscles cannot function properly without something else the body depends on: circulation. And after 60, circulation to spinal tissues becomes one of the most overlooked drivers of chronic back pain. Let's explore why. Your spine is not a static structure. It's a living, metabolically active system that relies on continuous blood flow to maintain healthy tissues. Blood delivers oxygen, nutrients, hormones that support tissue repair, and it removes inflammatory waste products that accumulate during normal movement. But here's what changes after age 60. Circulatory efficiency begins to decline. Blood vessels lose some of their elasticity. Capillaries supplying deep muscles become less responsive. And overall blood flow to certain tissues may decrease. This becomes particularly important for the intervertebral discs, the shock-absorbing cushions between spinal bones. Unlike many tissues in the body, spinal discs have very limited direct blood supply. They rely heavily on diffusion, meaning nutrients move slowly from surrounding tissues into the disc, and movement plays a critical role in this process. Every time you walk, bend, or change position, the discs experience gentle compression and release. This acts like a sponge. Fresh nutrients are drawn in, waste products are pushed out. But when movement decreases, which often happens with age, this nutrient exchange slows dramatically. Discs gradually lose hydration, they become less resilient, and surrounding tissues may become irritated. But here's where most people go wrong. When their back hurts, they stop moving. And while that seems logical, extended inactivity can actually reduce circulation even further, worsening stiffness and inflammation. It becomes a vicious cycle. Pain leads to less movement. Less movement leads to poorer circulation. Poor circulation leads to more pain. Breaking this cycle requires something surprisingly simple: gentle, frequent movement throughout the day. Not intense workouts, not complicated routines, just consistent activation of circulation. One of the most effective strategies is short walking sessions. Walking stimulates blood flow to spinal muscles, discs, and nerves. Even 5 minutes every hour can dramatically improve circulation patterns. Another powerful tool is spinal mobility movement. A simple example is the cat-cow stretch. Performed slowly and gently. On hands and knees, slowly arch the back upward, then gently lower the spine into a comfortable curve. This movement helps distribute fluid within spinal discs and improves flexibility. But circulation is not influenced by movement alone. Nutrition also plays a critical role. Recent research in vascular health shows that certain nutrients help maintain healthy blood flow and reduce inflammation. Foods rich in omega-3 fatty acids, such as salmon, walnuts, and flax seeds, can support anti-inflammatory processes. Leafy green vegetables provide nitrates, which help blood vessels relax and improve circulation. Magnesium, found in almonds, pumpkin seeds, and spinach, supports muscle relaxation and nerve function. But here's where it gets even more interesting. Hydration also affects spinal health. Spinal discs are composed largely of water. When the body becomes dehydrated, discs lose volume and elasticity, increasing pressure on surrounding joints. Even mild dehydration can contribute to stiffness. This changes everything after age 60, because many older adults unintentionally reduce water intake. Simply increasing hydration can improve tissue function and flexibility, but circulation and muscle support are still only part of the story, because there is another factor quietly influencing back pain that most people never consider: your nervous system. And when nerve sensitivity increases with age, even small mechanical stresses can feel much more painful. Understanding this process may be the key to finally reducing chronic back pain without relying solely on medication. Let's look at what spine specialists are discovering about nerve sensitivity and how calming the nervous system can dramatically change how your back feels. Here's something spine specialists are paying much closer attention to today. Two people can have the same physical condition in their spine, yet one experiences severe pain while the other feels very little. Why does that happen? The answer often lies in the nervous system itself, because pain is not produced only by damaged tissue. It is produced by the brain interpreting signals from nerves. And as we age, those nerve signaling systems can become more sensitive. Recent clinical findings suggest that after the age of 60, the nervous system may enter a state known as central sensitization. This simply means the brain becomes more reactive to pain signals. Signals that were once mild can begin to feel intense. Pressure that was once tolerable may suddenly feel uncomfortable. Even small muscle tension around the spine can trigger a larger pain response. But here's what most people over 60 don't realize. This heightened sensitivity is often driven by inflammation. When tissues around the spine become irritated, whether from muscle strain, poor circulation, or joint stress, the body releases inflammatory chemicals. These chemicals have an important purpose. They help initiate healing. But when inflammation becomes chronic, it also lowers the threshold of nearby nerves. In simple terms, the nerves become easier to trigger. This is why many people notice their back pain feels worse during periods of stress, fatigue, or poor sleep, because the nervous system itself becomes more reactive. But here's where the situation becomes even more complex. Chronic pain doesn't just affect nerves in the back. Over time, the brain begins to anticipate pain. Certain movements may start to feel threatening even before they occur. The body tightens muscles defensively, and this protective response can actually increase strain on the spine. It's a survival mechanism, but when it becomes chronic, it keeps pain locked in place. If you ignore this, here's what happens. The body enters a feedback loop. Pain triggers tension. Tension reduces circulation. Reduced circulation increases inflammation. Inflammation sensitizes nerves even more. And the cycle continues. But this is where most people go wrong. They assume the only solution is stronger pain medication. Yet, medications often work by dampening the signal temporarily, not by addressing the biological drivers of nerve sensitivity. Fortunately, researchers and spine specialists have identified several strategies that can calm the nervous system naturally. And these approaches are surprisingly simple. The first is controlled breathing. Slow diaphragmatic breathing has been shown to activate the parasympathetic nervous system, the body's relaxation and recovery mode. This helps reduce muscle tension and lowers inflammatory stress hormones. A simple technique involves inhaling slowly through the nose for 4 seconds, allowing the abdomen to expand. Then exhaling slowly through the mouth for 6 seconds. Repeating this for 5 minutes can noticeably relax the muscles surrounding the spine. Another powerful method is heat therapy. Applying gentle heat to the lower back increases blood flow and helps relax tight muscles. Improved circulation allows oxygen and nutrients to reach irritated tissues, supporting the body's natural recovery processes. Many physical therapists recommend 15 to 20 minutes of heat in the evening when stiffness tends to increase. But here's something that surprises many people. Sleep quality also plays a major role in nerve sensitivity. During deep sleep, the brain clears metabolic waste from neural tissue and resets pain processing pathways. However, as people age, sleep patterns often change. Sleep becomes lighter. Nighttime awakenings become more frequent. And when sleep quality declines, pain sensitivity can increase the next day. This changes everything after age 60, because improving sleep may reduce pain perception more effectively than many people expect. Maintaining consistent sleep times, limiting caffeine in the afternoon, and reducing screen exposure before bed can help restore deeper sleep cycles. But nerve sensitivity and inflammation are still only part of the story, because many daily habits that feel completely harmless, may quietly be placing extra strain on the spine. And once you see them, it becomes clear why back pain persists for so many people. Let's examine the everyday behaviors that spine specialists now say are silently worsening back pain after 60. By the time someone reaches their 60s, they've usually tried many things to ease back pain: pain relievers, heating pads, occasional stretches, maybe even physical therapy, and yet the discomfort often returns. Morning stiffness, tightness after sitting, a dull ache that builds slowly through the day. But here's what spine specialists are now focusing on. In many cases, the largest contributors to chronic back pain are not dramatic injuries. They are small daily habits repeated thousands of times, habits that slowly place stress on the spine. And over time, the body adapts in ways that create persistent discomfort. What most people over 60 don't realize is that the spine responds less to one large event and more to repeated mechanical stress. Tiny strains, subtle posture changes, long periods of immobility. Individually, they seem harmless, but together they create the conditions for chronic pain. Let's look at the 3 habits spine specialists most commonly identify. The human spine was designed for movement, small adjustments, frequent changes in position, shifting weight throughout the day. But modern life encourages something very different. Long, uninterrupted sitting, reading, watching television, working on a computer, driving. When someone sits for extended periods, several things begin to happen inside the body. The hip flexor muscles shorten, the pelvis tilts forward, and the natural curve of the lower spine becomes exaggerated. At the same time, circulation to the deep spinal stabilizers begins to decrease. Those muscles gradually disengage. But here's where it gets more serious. After about 30 minutes of sitting, pressure on the lumbar discs increases significantly. Fluid begins to move out of the discs. The joints stiffen, and the muscles surrounding the spine tighten to compensate. If you ignore this, here's what happens. When you finally stand up, the spine temporarily loses some of its mobility. The muscles feel tight, Movement feels restricted. That familiar ache appears. But the solution is not complicated. Spine therapists often recommend what they call postural resets. Every 30 minutes, stand up, walk for a minute or two, roll the shoulders back, gently extend the spine by placing your hands on your hips and leaning slightly backward. These small movements restore circulation and relieve pressure inside the discs. Over the course of a day, these resets can make a remarkable difference. This may surprise many people, but some of the most important muscles protecting your back are not located in your back at all. They are the gluteal muscles. The glutes stabilize the pelvis and control how force moves through the spine during walking, standing, and lifting. When these muscles are strong, they absorb much of the mechanical load placed on the lower back. But here's what happens with age and inactivity. The glute muscles begin to weaken, sometimes dramatically. This condition is sometimes called gluteal inhibition. The muscles essentially stop activating properly. When that happens, the lower back is forced to compensate. Each step, each time you rise from a chair, each time you bend slightly, the lower back muscles take on work that the glutes should be handling. Over time, this creates fatigue and inflammation in the lumbar region. But this is where most people go wrong. They focus only on stretching the back. While stretching can help temporarily, it does not solve the underlying imbalance. Instead, spine specialists often recommend simple strengthening movements, such as glute bridges. Lying on your back with knees bent, slowly lift your hips toward the ceiling while tightening your glute muscles. Hold for 5 seconds, then lower slowly. Just 10 repetitions a day can begin restoring this crucial support system. And when the glutes start doing their job again, the lower back finally gets relief. Sleep should be the body's time for recovery. But for many adults over 60, the way they sleep may actually be contributing to morning back pain. Here's why. When the spine remains in a twisted or unsupported position for several hours, muscles remain under low-level tension throughout the night. Ligaments may stretch, joints may become irritated, and by morning, stiffness has already developed. One common issue is sleeping on the stomach. While it may feel comfortable at first, stomach sleeping forces the neck to rotate and increases arching in the lower back. Over time, this position can strain spinal joints. Another issue involves mattresses that are either too soft or too firm. A mattress that is too soft allows the pelvis to sink downward, increasing spinal curvature. One that is too firm may create pressure points along the shoulders and hips. Spine specialists often recommend side sleeping with a pillow between the knees. This helps keep the pelvis aligned and reduces rotation in the lower spine. For those who prefer sleeping on their back, placing a pillow beneath the knees can help maintain the spine's natural curve. But here's where many people notice something remarkable. When sleep posture improves, morning stiffness often decreases within days, because the spine finally has several hours each night to recover properly. It's important to acknowledge something that rarely gets discussed openly. Living with daily back pain can be frustrating. It can make simple activities feel difficult, standing longer than expected, walking farther than planned. Even enjoying hobbies can become challenging. Over time, many people begin to wonder if this is simply what aging feels like. But that belief is not supported by science. Many adults in their 60s, 70s, and even 80s maintain strong, pain-free backs. The difference usually lies in how the body is supported through movement, circulation, and recovery. But here's where it gets even more encouraging. When these habits begin to change, even gradually, the spine often responds faster than people expect. Pain levels decrease, mobility improves, confidence returns, and daily life begins to feel easier again. But to truly support spinal health after 60, it helps to bring all these pieces together: muscle support, circulation, nerve sensitivity, daily habits, and recovery. In the final section, we'll walk through a simple daily routine recommended by spine specialists, one designed specifically for adults over 60. a routine that takes less than 20 minutes a day, yet can dramatically improve spinal stability, circulation, and comfort. Because before reaching for another pill, there are powerful ways to help your body restore balance naturally. By this point, a clearer picture begins to emerge. Chronic back pain after 60 is rarely caused by a single issue. It's usually the result of several small physiological changes happening at the same time. Muscle support slowly declining, circulation becoming less efficient, nerves becoming more sensitive to inflammation, daily habits quietly placing stress on the spine. Individually, each factor may seem minor, but together they create the conditions where pain becomes persistent. The encouraging news is this: when these systems begin improving together, the body often responds in powerful ways. Mobility increases, inflammation begins to calm, muscle coordination returns, and pain signals gradually become less intense. This is exactly why many spine specialists now recommend small daily routines rather than isolated treatments. Instead of waiting until pain becomes severe, they encourage a short daily investment in spinal health, not an hour-long workout, not complicated equipment, just consistent support for the systems that protect the spine. And in many cases, the entire routine takes less than 20 minutes. Let's walk through the structure of that routine. The first few minutes after waking are important. During sleep, spinal discs naturally absorb fluid and become slightly more hydrated. This is a healthy process, but it also means the discs are temporarily more sensitive to sudden strain in the morning. That's why spine specialists recommend gentle mobility before heavy movement. Start with a simple spinal warm-up while still on the bed or on a comfortable surface. Slowly bring your knees toward your chest and hold for about 10 seconds. Then gently release. Repeat several times. This movement allows the lower spine to move through a comfortable range of motion and encourages circulation to surrounding muscles. Next, try a slow pelvic tilt. Tighten your abdominal muscles slightly and flatten your lower back against the bed. Hold for 5 seconds, then relax. Repeat 8 to 10 times. These small movements activate the stabilizing muscles that support the spine throughout the day. And here's the important part. They signal to your nervous system that movement is safe. That reduces protective muscle tension that can contribute to pain. But this is where many people skip an important step. They rush directly into daily activity. Yet adding just one more element can significantly improve spinal circulation. Walking is one of the most powerful therapies for the spine. It stimulates blood flow, it activates stabilizing muscles, and it encourages healthy movement of spinal discs. But here's where most people go wrong. They assume exercise must be intense to be effective. In reality, the spine responds extremely well to frequent, moderate movement. Even 5 minutes of relaxed walking in the morning can begin improving circulation throughout spinal tissues. This simple habit acts like a nutrient pump for the discs and muscles supporting your back. And when circulation improves, the body becomes better at clearing inflammatory chemicals that irritate nerves. Movements. The first is the abdominal brace. Lie on your back with knees bent. Gently tighten your abdominal muscles as if preparing for a light cough. Hold that contraction for 5 seconds while breathing normally, then relax. Repeat 10 times. This movement strengthens the deep core muscles that stabilize each vertebra. Next is the glute bridge. With knees bent and feet on the floor, slowly lift your hips while tightening the glute muscles. Hold for 5 seconds, then lower slowly. Repeat 8 to 10 times. This restores strength in the muscles that protect the lower back during daily movement. Another valuable exercise is the bird dog movement. On hands and knees, slowly extend one arm and the opposite leg. Hold briefly, then switch sides. It may seem like an unavoidable part of aging, but research tells a different story. The spine remains remarkably adaptable throughout life. Muscles can strengthen, circulation can improve, nerve sensitivity can calm, movement can become easier again. But this is where the real shift happens. Instead of waiting for pain to appear and reacting with medication, many specialists now encourage proactive spinal care.